I'm John Urbans, President and CEO of Greater Fort Wayne Inc. I want to thank you for joining us today on our Roadmap to a Healthy Reopening webinar series. This next hour, we will be focused on the small business industry. Again, thanks for joining us. I want to thank our partners in this endeavor, Parkview Health, the Allen County Department of Health, and the Northeast Indiana Regional Partnership. I want to specifically thank Dr. McMahon and Mindy Waldron from the Department of Health for their great leadership in helping the community through this pandemic. Also, Heather Shagler at Parkview and the staff at Greater Fort Wayne Inc. and the Regional Partnership as we put this program together. It's our privilege to bring this critical information to you as the business community. A lot of time and effort has gone into this endeavor, and I thank you for listening to us today. Just a little bit of housekeeping. We will be leaving significant amount of time on the second half of the webinar for questions and answers with the health professionals. We will be using the chat function or the Q&A tab on the bottom of your screen to collect this information. As we get to that point, you can start to use the Q&A tab to do that. You will be receiving an email immediately following this webinar with a survey for you to provide input to us. And then you also receive a second email that has a copy of the slides from this presentation and a recording of the webinar that you can share with others. I want to thank all the participants for submitting questions in advance. These questions served as a guide for the Parkview team to help develop the content. While we may not be able to answer every specific question, we hope that the information shared will address your most pressing concerns. I'd like to introduce the team from Parkview. We have Jolynn Succo, the Chief Innovation Officer. We have Dr. Jeffrey Board, Chief Safety and Quality Officer. Dina Jackway, Chief Community and Human Resource Officer. And Dr. Mike Nip, Parkview Total Health Chief Medical Officer. They'll be presenting a lot of information to you, and then all will be participating in the Q&A. Jolynn, I'll turn it over to you.
Great, thank you very much. So like John said, I have the privilege of serving as the Chief Innovation Officer for Parkview Health. I want to start by saying thank you for all you have done for us as we've cared for you. Thank you for staying home to slow the spread of COVID. We have really been overwhelmed by the generosity of our community and region. We've received hundreds of cards. We've distributed thousands of donated meals to our coworkers, and we were moved by the flyover of the 122nd Fighter Wing and the socially distanced prayer vigils in support of our team's response to this pandemic. We are humbled by your generosity. I also want to share a little bit about how we're doing. So you can take a look at our COVID impact meter. We are cautious, but we are not in a crisis, and we haven't been in a crisis since we began 60 days ago. We are prepared to take care of the needs of our region, and we've been taking care of our patients since we opened our command center 60 days ago. We're starting to see hospitalized patients with COVID begin to plateau. And we're also starting to see people come back to the emergency room to seek really necessary care. This is really important because we know that there are people who are delaying care in this pandemic. So we're hopeful. We, like you, are beginning to think, how are we going to begin to safely open up the parts of our operations that we've suspended due to COVID? And we're thinking a lot about how does the world look differently today than it did 60 days ago? As we think about this, there's important considerations that will continue to guide our action. First, we are going to continue to have positive cases of COVID throughout the community. We know that the most optimistic timeline for a vaccine is 12 to 18 months, and there's no herd immunity. We also think it'll be a little bumpy as we reopen, and we want to keep those surges as low as possible. We're also operating in a world where the information we have is evolving and dynamic. We're implementing safe practices that will help our coworkers, customers, and community. And we know that in times of crisis, we're challenged to think differently. We're challenged to innovate and emerge stronger. We spent a lot of time thinking about all aspects of our operations and how to open in the safest way. As the community, you have been so generous with us, and today we'd like to return that generosity to you by sharing what we are learning and doing. You're going to learn more about some free service offerings later in the webinar, but one thing that we've created is a website to share what we have learned, as well as what others are doing in a variety of industries. This website will be a living and breathing website. It will evolve as the dynamic situation evolves. We have it full of workplace considerations and people considerations. We've also established a hotline with a one-day turnaround where you can answer questions from our subject matter experts in a variety of areas. We want to stay in dialogue with you, our community, so that we can all open safely together. With that, I will turn it over to Dr. Jeff Ford, who will share more about our approaches to how we keep our workplaces safe.
Thank you, Jolynn. Thank you, everybody, for joining us on this webinar today. So to begin, think about your sense of place. Think about the built environment where you are providing services, those spaces where your coworkers, your customers, your clients engage. Do you have spaces where you have employees only, spaces where you have employees and customers? Do you have areas where you have common areas that might be shared with other establishments or have common lobbies? The recovery plan needs to consider the current community status of COVID-19. Currently, the COVID-19 virus is in community spread in the United States. And what does that really mean? That means that the source of infection for any given new case cannot be pinpointed. So we see a patient in the clinic, in the emergency department or hospital that has fallen ill from COVID-19. There's really not any reliable way to determine where they picked up the virus. Everyone in the community is potentially susceptible to the infection because it is a novel coronavirus and there is no prior immunity, and we do not yet have a vaccine. Even though everyone has an equal chance of contracting the illness, some individuals in our community are at more risk for severe illness relative to others. So we know from experience with COVID-19 and our medical literature and our experience here at Parkview Health that older adults are more likely to have severe illness, as are adults that have other chronic health conditions. So those people can be more vulnerable to severe illness if they were to contract COVID-19. A very useful occupational health and safety framework is what's called the hierarchy of controls. Hierarchy of controls has 4 major levels, and the top level having the greatest efficacy down to less levels of effectiveness down at the lowest level. So the first is elimination, physically removing the hazard from the work environment or from the coworker. Second is engineering controls, is where you isolate people from the hazard. Third is administrative controls, changing the way that we do our work, meaning things like operational workflows, behaviors, how we do things in the workplace that help modify risk. And then finally, at the bottom, the last line of defense is personal protective equipment. When we think of personal protective equipment, we need to match the right type of PPE to the task and the risk that particular employee or hazard is being exposed to. And we also need to ensure that there is proper training on the use of the PPE, particularly putting it on and taking it off. The CDC recommends that all businesses consider the following controls. Think about the engineering controls in the building ventilation system. Think about your administrative controls. How are you educating coworkers on things like respiratory etiquette and hand hygiene for anyone who might visit your workplace, be that customers, vendors, or otherwise. Think also about the new normal in coexistence with COVID-19 means that we're going to have to have very robust strategies around regular cleaning and disinfecting of high-touch surfaces throughout the workday. I want to spend a little bit of time talking to you about testing. There's been a great deal of attention regarding testing in the media, and it can be very confusing given that there are more than one type of test and that the tests have different uses and limitations. First, let me talk about antibody testing. This is done through a blood sample. This does have a very important use for population surveillance of past infection within a community. So this is currently being used by the Indiana State Department of Health in cooperation with the IU School of Public Health to do a comprehensive survey by sampling a number of adults in every county in our state. And by doing this, we can get a good sense of what has been the extent of spread of COVID-19 in each community within each county across our state. And this helps inform public health measures as well as policy decisions going forward as we confront and manage the new normal of the pandemic. It also plays a role in research of COVID-19. Some of the very important limitations of antibody testing is right now medical science does not know whether or not having a detectable antibody on a blood test is actually protective, meaning we do not know for sure whether having antibodies would actually protect an individual from reinfection. We also do not know if having antibodies in any way reduces the risk of being able to pass the infection on to others. In order to rapidly get tests developed into market, the FDA relaxed its standard regulatory procedures and evaluation methodologies for diagnostic testing. This means that only a handful of tests have even been looked at through the emergency use authorization of the FDA. The majority that are currently on the market have not had any scrutiny or evaluation by the Food and Drug Administration, have not undergone extensive large-scale validation in a certified clinical laboratory, and as a result, many tests available on the market today are inaccurate or unreliable. Because of these limitations, an antibody test is totally inappropriate for any return to work decisions for an individual employee. Next, I want to talk about PCR testing. This is done by a nasal or nasopharyngeal swab, and this is to diagnose active infection in people with symptoms that might be COVID-19. This is what we use in the clinic, in the emergency department, or the hospital to diagnose someone with COVID-19 that have symptoms. This relies on detection of RNA within the virus that are in particles that are being shed in the upper airway at the back of the throat. We use the swab to collect a sample, and the test actually uses a special method to look for the virus RNA material to detect infection. If the person is at an asymptomatic stage and they're not actively shedding virus in the back of the throat, however, the swab will not be able to reliably detect the infection. This means that this test is very insensitive and often will have a false negative result in an asymptomatic person. So this test is limited and really should not be used just to test unselected asymptomatic adults because it's very likely not to detect the virus. So as a result, people should not be using a nasal PCR swab, for example, prior to screen everybody because it's not reliable to detect virus in asymptomatic adults. It's not sensitive enough. Second, it also is just a snapshot in time. So all we can tell you from that test is at the moment we do that swab at the back of the throat, do we have virus there at that time? If someone has a negative PCR test on Monday and they get exposed on Wednesday, they can be infectious later that week, and that PCR test on Monday can be negative. So it's only a snapshot in time, and it does not in any way tell you whether someone could be infectious in the future. When we talk about the hierarchy of controls here at Parkview Health, we talk about this as more than a mask. So we use all of the hierarchy of controls in our workplaces, both in our clinical and non-clinical areas. So one of the important ways, for example, to eliminate risk in the workplace is to have people stay home if they're sick. Having virtual meetings also eliminates the risk of infection because people are not getting together virtually. There's no interpersonal contact. Making sure that any unnecessary visits are canceled, or using virtual health in our setting have been very useful tools to eliminate risk. We did over 6,000 virtual health visits last week alone to provide care to people in the community that need it, while not risking any exposure to patients or other coworkers of people who could be infectious. Second is engineering controls. We use this in the healthcare setting all the time. We have areas where we have special negative airflow rooms, for example, for respiratory isolation. We use physical barriers to help protect workers from hazards and other features. We use administrative controls, changing our cleaning processes, frequently cleaning work areas, making sure that people have regular access and are trained on frequent hand hygiene. And then finally, that PPE, selecting the right kind of PPE and make sure the people are properly trained on how to use that PPE effectively. Now I'm going to turn things over to Dina Jackway, our Chief Community and Human Resources Officer.
Thanks, Dr. Board. So we recognize the last 50, 60 days has been, like one of our local CEOs put it, it's like flying a plane and trying to fix it at the same time. Our world has changed, our organizations have changed, and so we recognize how important information that we can share with you certainly is. When we talk about people, I think it's important we think about people are the most valuable in an organization. The coworkers that work there, of course, for businesses, the customers that are coming in, and vendors, and our entire community at large. And so when we think about going into, Dr. Board talked a lot about place, and today we're going to talk a little more about people. And when we think people, looking at it a little broader than those that just work within your organizations to help round things out. The first that I would say, the CDC had shared some really great feedback, and the first of which I think is really important, and that is identify a workplace coordinator. I realize on all of you in the organizations that are listening have an HR department, and that's okay. But I think the first and foremost would be to find an individual that can be that source of truth, that can be gathering all of the information. One thing I think we've definitely learned is things change so fast right now, that having someone that is responsible for that would be wonderful. Coworkers are receiving information from a variety of sources right now. So they're watching national news, or they may be looking at social media for their information. And so to have someone that can coordinate that for what they need to know where they're working. Because we know that fears are running high. We know that individuals are concerned about coming back to work. So giving them as much information as possible about their workspace is going to be very important. Implementing flexible policies and procedures. So flexibility right now is frankly for all of us so important. And the way we've always done things may not be what we need to do in the future. As a matter of fact, I would say most everything needs to be edited and at least analyzed for how do we need to do this differently. So being flexible on behalf of the organization, and not only that, but what we're expecting of our coworkers. Education is also extremely important. And right now, as I said earlier, people are receiving their information from a variety of ways and places. But as an organization, you also need to be sharing the why. So as you're talking to your coworkers about why we're changing certain policies or procedures or guidelines, or what we need them to be doing, or perhaps what they need to be wearing now, always include the why, because I think that just rounds out better communication and really helps calm a lot of the fears that we know that right now our coworkers are having. Also considering when you're looking at social distancing policies, which we all know that we're having to look at things a little differently around break rooms, around public spaces, and all of the areas within businesses. Also consider you're vulnerable, and consider that some of your coworkers may need accommodations. Perhaps they have other underlying conditions that they can't do the things that they once could. Not only that, but you might need to also accommodate those vulnerable when it comes to your patrons and your customers. And so be thinking about what you can put into place to accommodate both of those. Having a process is going to be really important. On the staffing side, a few points that I'll make here. It's really important, and flexibility, again, is so critical, but you're going to be asking your coworkers to be doing some different things that perhaps was not part of their role before. So a really good example I like to share in our world is we had a host of athletic trainers that were within schools and helping. They're not doing that right now because we don't have school in session. And because of that, we've redeployed them all across the organization in different departments. And some are on nursing units helping provide backup support. Some are in office roles and working in other areas to provide additional support. So you may be asking your coworkers to do things different than they've ever done, and that's okay. But it's also, we're asking them for flexibility. We need to provide them some flexibility because we also know that with perhaps school-age children or child care difficulty for some families, they may not be able to work the same hours that they once did. So promoting the remote workforce as much as possible, but where not possible, how can we shift hours? Because child care availability is certainly something we need to be cognizant of. When we think about remote coworkers, so Parkview right now has about 4,500 individuals who are working from home. And frankly, that happened very fast and very quickly. And now we're talking about bringing some of them back. But I think the key for us is bringing individuals back. We can't bring all 4,500 back at the same time. And so thinking about you and having remote workforces right now, do you need to bring everybody back at the same time? And we've given guidance to our coworkers from home saying, regardless of what the governor says tomorrow afternoon, everyone will stay working from home that is working from home. And we want to phase back. And for us, with 13,000 coworkers, we're trying to think about the percentage of individuals that would come back at a time of that 4,500 I mentioned that are at home. We don't want to bring everyone back. We don't want to even bring all of the same positions back at one time. So being thoughtful about who you can bring back, and if you really even need to bring anyone back at this point. All very subject to what your businesses are. Then I would say, what are the things that you would take away from this new normal that you want to continue on in the future? And this is obviously so industry specific, but there have been some great best practices and from a customer standpoint that you might want to continue so that as people are receiving your services or in your organization, they may do that a little differently long term than just perhaps as we're working through COVID-19. I want to share a little bit about our return to work process. And while I won't get into the particulars, I want to encourage all of you, as you have, this is not really about working from home and coming back. These are for your coworkers who are sick. These are those that had a family member that was ill or they've been ill. And how they come back into the workplace is really important because you want to make sure you have a process because you want to keep not only them safe, but you need to keep the rest of your workforce safe. And of course, anyone coming into contact with your business safe. So it's really important to have a process. We'll share ours out on the website, as Jolene mentioned earlier, where you can get more additional resources. But having that process will be extremely important to make sure everyone is safe in this. And finally, I'll share a few of what Parkview is doing. Now, these are just a few things that we've done. There's a whole host of other things we've done, and happy to go through that with you at a later time and on the Business Connect site. But a few of these I think apply to all of you listening. And one is simply asking what people need. And one of the things we talked about right in the beginning is what barriers do our coworkers have? What do they need? And so we simply asked them. And it sounds simple, but it gave us so much feedback. The voice of the coworker, you cannot underestimate how important that is because it's going to tell you what you in turn need to be communicating with your workforce. Flexing benefits, for those of you that are able to offer benefits, think about where you can flex them so that you give coworkers more availability and more access to those benefits in maybe different ways than before. And again, that's just accommodating what they're needing right now as well. Childcare, I mentioned earlier, that's just another way to maybe flex on where you can provide support. And mental health, we cannot underscore right now, everyone is going through things very differently. You cannot have a one size fits all. And so because of that, how are you working through what the mental health needs of your coworkers are? And simply, again, asking them what they need can help provide you some better support. And we want to provide more of that mental health support on our Parkview Connect site for you. And then finally, asking customers, what better way for you to know how your customers are feeling, asking them, how are they going to be expecting to engage with your business? You want to be prepared for that because you don't want them to be surprised or feel as though you're not keeping them safe. And so updating your website, making sure that you're asking them key questions about how they want to engage with your business so that, again, you can be nimble and adapt and flex as you go. How you start and recover on day one may look very different than a week into or 2 weeks into it, and even further out. So constantly asking for feedback is going to be really important so that you can be ahead of the curve. I'm now going to turn it over to Dr. Nip. Thank you.
Thanks, Dina. Hi, everybody. Dr. Mike Nip here. A couple OC Health insights for our friends here. So I want to look at the chart again up here. You'll recognize the right side is the high-grade controls with some examples. I'd like to spend just a little bit more time to focus, though, on the orange section on the left. So these are a couple things to call out. The first thing would be on any strategy, we again want to try and be as high up on the hierarchy as we can with elimination, for example. But whenever you come to a solution, wherever it is on the scale, is trying to make the optimally safe and healthy choice as easy and as automatic for your employees and for your customers. The second thing to touch upon is looking inward for innovation. The person that unties that Gordian knot of how to solve a problem, it may be their first day on the job. You're going to have your end users who know your business, you know your business as well, may come up with what is the keystone for moving forward for you. The third thing is it was mentioned a little bit ago, but to be very open and transparent with your customers and your employees for what you're doing to optimize their health and safety in your process and in their experience. So this slide right here comes out of the Toyota document and manual for what they are doing. I want to just call attention to a couple things. Is there, depending on your workplace, many different spaces to consider for solutions. There's a couple on here you may have not have thought of. I'll highlight maybe even the vending machine area. And as you can see there, they talk about an elimination strategy if possible. And of course, you want to find the most effective thing, but if you can't, what's the next thing you could do? Here's a couple other ones to take into consideration. I wanted to focus on a little bit on bathrooms. For example, finding a fairly simple solution, even regarding these what are being called high-touched areas, even just moving the trash can closer to the door. So when a person finishes drying their hand with that paper towel, they can use it to touch the high-touch handle, open it, and then dispose of the paper towel without having had their hand contact that high-touch area. This slide here calls out, Jolene's going to talk about this here a little bit more in a second, but when you go to the Business Connect site, you'll find a specific area for a small business that what it is regarding kind of the best of the best that we found resource-wise to help start it to approach some strategies for you to address some of these issues that you're going to be experiencing and trying to find solutions for. And having said that, I'm going to pass it on back to Jolene here.
So we're really excited to launch Parkview Business Connect. as we continue to operate in a pandemic, we want to help leaders lead. And when you think about Parkview as healthcare, that may be the first thing that comes to mind, but we're also the largest employer in the region. We operate 10 cafes, we have a police force, we have an extensive grounds crew, we have office areas, we have frontline areas and clinical areas. So we are really learning every day in all of these settings. The dynamic of this pandemic is changing rapidly, which means our responses will be changing as well. So Parkview Business Connect offers coaching for a safe phased approach to reopen your business. We're going to share the best practices that we have, as well as sourcing best practices from other industries. We have launched a website where you can access some of these helpful resources. You can also connect with our subject matter experts by clicking on the green button and sending an email or calling us at 260-CONNECT, and we will get back to you within one business day. And this website and these services are going to continue to evolve as the situation changes. So we'll be sending out things to come and look back for, and continually adding to this as our situation evolves. So with that, John, I'm going to turn it back to you for Q&A.
Thank you, Jolynn. Thanks to the team at Parkview for all the information that they provided with us today. We've got a lot of time left for Q&A. So again, I thank everybody for the questions they submitted early on. Please also use that Q&A tab down at the bottom of the screen. The first question I'm going to pose to our experts is, should I require all my employees to wear a mask while they work? And if so, what kind?
This is Dr. Ward, and when we think about masking in a workplace, it's important to remember the hierarchy of controls, thinking about have you first considered elimination, have you thought about administrative controls, have you thought about engineering controls before going to that bottom of that hierarchy, which is personal protective equipment. It's also important to keep in mind that wearing a cloth face covering in public, as recommended by the CDC, has a very distinct purpose from what we typically think about with personal protective equipment. If I'm wearing a cloth face covering or cloth mask in a public place such as a grocery store, what I'm doing is I'm actually protecting other people from my coughs and sneezes. So it's what's called source control. The mask is really not designed to protect me personally, it's to protect others from my respiratory secretions, coughs and sneezes. And it's really only going to be really useful if most people are wearing that mask for source control when we're thinking about public areas. This personal protective equipment, such as an N95 respirator that I might wear when I'm seeing a patient that has COVID-19, is to protect me from the respiratory pathogen. So it's important to make distinctions about what kind of personal protective equipment we're talking about and what's the goal. Is the goal source control, like we would with the CDC, with members of the public? Are customers in your place of business going to be wearing them? Or, if you're going to have masking, then everybody needs to be doing it to maximize benefit around source control. It's also important to think about all of the requirements for using PPE. Otherwise, you need to follow your state, local, and industry regulations, and also make sure that if in your business, for example, you have a coworker that's working with a hazardous chemical or fumes, they need to have the appropriate type of PPE for the hazard that they're dealing with and the type of task. So just making sure to think about those considerations.
To follow up a little bit, we've had a question on are there levels or benchmarks of cases, deaths that we should be watching as we, to determine safely going back into public, as people have lots of different levels of comfort as they move outside?
Well, it's a good question. There have been some metrics that have been proposed by the White House, for example, national metrics. The Indiana State Department of Health and the governor's office is looking at measures of the activity of COVID-19 in our community. For example, we submit on a daily basis all of our patients hospitalized with COVID-19, how many patients are in ICU, how many patients require a ventilator. Every hospital in the state is submitting that data on a daily basis to the Indiana State Department of Health. They're also, every test, every positive COVID test is reported to the Indiana State Department of Health. And in aggregate, all of this testing data, hospitalization data are being used by the state to kind of help assess disease activity. And it varies by region. So, for example, there's been more disease activity, more disease burden in Marion County around Indianapolis than we've had in Northeast Indiana. So I think that we have to not just look at national data, but we need to look at our statewide data and also look at data within our region. And the Indiana State Department of Health has provided some great resources, as has the Howland County Health Department and our other county health departments in the region around a number of new cases.
You know, one of the questions we hear a lot is, you know, how do I make sure that my employees are virus-free when coming to work? Should I be doing temperature checks at the start of every shift? Great
question. I hate to be a Donnie Downer, but unfortunately there is no foolproof method that we know of, or that anybody else knows of for that matter, that can guarantee someone is virus-free walking into your place of business. So some things that do really help though. So first of all, when we're talking about employees, don't come to work sick. Make sure your employees clearly understand that you support them, that they have a clear and simple process to report if they are ill, and facilitate making it easy for them to stay home from work if they are sick. That's probably the single most important intervention you can do when it comes to your employees. Second, hand hygiene, social distancing, regular cleaning also greatly mitigates the risk in the workplace, whether that's virus shedding from an employee or a customer, the social distancing, the hand hygiene, the cleaning work surfaces, all of those things, those engineering controls can help greatly mitigate the risk of spread in the workplace. So think about all of those things. Let me talk a little bit about temperature. So on the surface, it seems like temperature seems like a simple thing to do in that it's an easy way to screen people at the door, so to speak, whether that's customers, vendors, visitors, or employees. The challenge is that the medical literature has shown that with COVID-19, that fever often is absent. So over 50% of patients who get admitted to the hospital with COVID-19 may not have a fever at the time of admission. They may develop it later in the course of their illness, but it is not a reliable upfront indicator that all patients are going to have. And so people can be infectious and not have a fever. They're not going to have a high temperature. So it's just not reliable enough to effectively screen out anybody who may be infectious into your place of business or workplace. There's also some other important caveats around temperature. So if I'm going to put somebody at the door to do temperature monitoring, first of all, I got to monitor everybody. Second of all, I'm going to have to get within 6 feet of them in order to check their temperature. So I'm going to have to wear personal protective equipment to protect me if I'm checking everybody's temperature coming in the door. There's also challenges with the equipment that you might use. So these contactless little thermal scanner things that people that might, put on, near a forehead, those do not have precision to reliably detect a fever in humans because they're not really clinical grade. So most of those contactless scanners that you might buy, at a hardware store or something, have a plus minus 2 degree error rate. So you may not reliably identify people that have a fever using that particular piece of equipment. So there's also some considerations about using temperature to make employment decisions and ability to come to work. And I'm going to have Dr. Nip talk about that.
Thanks, Dr. Board. Well said. So it's with putting aside accuracy, availability, and supplies, as a policy, obviously it's going to have to apply to everyone from the owner of a business to the person whose first day it is on the job. the temperature reading itself, if it's going to be used to make a work decision, well, that has to be managed like another piece of protected health information. It's trying to figure out then who is going to monitor that information, who's going to be in charge of keeping it protected, either virtually on a computer spreadsheet or literally on a piece of paper that's locked in a filing cabinet. Those are I think, additional factors that, like Dr. Board said, something that seems very simple. I'm calling it a tiny pebble that makes a lot of big waves when it's thrown in, that you have to figure out the specific logistics of how to manage that, notwithstanding that, as we know from the science so far, it's just not very effective on identifying folks with COVID at this point.
It's also important to think also about this in the context of your policy and process for people being sick. So if you have hourly employees that do not have any ability to take days off work, that if they don't come to work because they're ill, they're going to be written up and they would be at risk of losing their job, you're putting people in a very difficult position. So if I'm an employee who depends on my job to feed my family and pay my bills, and I'm not feeling very good, but my employer does not have any easy way for me to report being sick and is going to penalize me or potentially fire me if I don't show up to work regardless, then I may try to figure out how I can get to work even if I'm sick, even if somebody's at the front door. Maybe I take some aspirin or ibuprofen so I don't have a temp when I come in, because I'm trying to make this terrible choice between, you know, compromising safety versus being able to keep my job and put food on the table. So, you know, we have to think about that big picture, and what's the safe approach, I think, is really the key.
Thanks for those. You've been pretty clear with us that we're going to be experiencing COVID in the workplace for a while. What if I have one of my employees that tests positive for COVID-19? Should I test everybody at work?
I can address that. So the short answer, as we see there, is no. Usually, as a guiding rule, I'd say, quote unquote, is asymptomatic folks can remain at work. What symptoms are we focused on? Temperature, you know, what temperature of the place we've generally set things is 100 degrees Fahrenheit. The other functional symptom, let's call it that, is a cough, meaning that's the one that is the spreading symptom. Like we see on the slide, you know, we would still, if someone calls and say, hey, I got a COVID test, I'm positive, what should you have your folks do? It's the self-monitor for those concerning symptoms for about 2 weeks. Obviously, if any of those develop, they would need to reach out to the employer, and their internal illness policy should be followed regarding needing to stay home and things like that.
Yeah, and if somebody is COVID positive but they don't have active symptoms, the ISDH has recommended as a strategy that they would self-isolate for 10 days if they are COVID positive. So some people have very mild illness, so they don't have really dramatic symptoms, but they would generally be safe to return to work after they've been out for 10 days from the date of the positive test if symptoms are not prominent.
And let me just add one more thing, Dr. Board. Sorry, I wanted to mention our 772 rule we've come up with. So if you do test positive, the ruling is assuming the 10 days you haven't developed those symptoms, but you kind of reset your clock. If you do test positive, then develop a fever, it would be wanting to 7 days from the onset of that. With 72 hours, fever is not there, and you don't have to use ibuprofen or something, and then your cough is either gone or improved. If not gone, you're going to be needing to wear a mask when you come back until that cough is gone.
How about if one of my employees went on vacation? Do I allow them to return to work, ask them to quarantine? Does it matter where they went?
Well, this has become a very interesting question because as the pandemic has progressed, now we have multiple areas where you have very high prevalence of the disease. So places like New York City area, for example, there are other places that, you know, New Orleans has had high prevalence of illness, for example. So one question is from where are you returning? The other thing is mode of transport, right? So, you watch the news and airports have turned into relative ghost towns, but if you're flying, you have a lot more contact with people. If you're taking a bus, you have a lot more contact with people than traveling through, say, in a personal vehicle. So method of travel is a consideration. If you have somebody who's coming back from an international location, that's going to be very challenging because they're going to get scrutiny at their port of entry. So if they're returning, they're going to be routed to typically one of about a dozen different airports in the U.S. And they're going to probably at the minimum undergo a health screening, a temperature check. And if they're coming from an endemic area, they may even require quarantine. And the State Department and the CDC have listed those really high-risk areas. So international travel is going to be more likely to trigger considering some sort of quarantine. But if they come from an endemic area, that's another area of risk. And so, if I tell my employer, yeah, I took a plane and I partied with a bunch of people right downtown in New York and had a lot of contacts and some people maybe were sick, you have to take that into consideration. But it's important to have some clear policy so you can make decisions that are consistent and equitable regarding returning to travel. We can't totally force people not to travel on their personal time, but we can certainly advise them on what might be more or less risky in any given circumstance.
Can we talk about how we safely socially distance ourselves in an office space? And maybe within this also, maybe we can talk about some of the liability we potentially have, because there's only so many things we can do to prepare ourselves.
Sure. This is Dr. Nipp. I'll take that. I mean, whenever I hear a word like liability, you need to be in touch with your legal folks. Let me take the second part first. I'm seeing the question here. I mean, the idea is the one way to eliminate the virus in your workplace is no one is there. That equals you don't have a business, and we don't want that. I think it's the same way of when I get into my car this afternoon, I'm doing everything I need to do to maximize and optimize how safe I'm going to travel on the road, knowing that there still is that factor I could still have an accident. I would be leaning towards kind of putting on my OSHA glasses right now, just saying, did the employer do everything following industry and the science guidance to check every box, as it were, that they tried to make the workplace as safe and as healthy as they could. That's kind of general duty clause language there. For more specific things, what can you do? You can see on the slide is it's really you all are experts on your spaces. It's applying the general strategies to your specific workplace, be it a meeting room, a cubicle area, and trying to at least take this as a touch point to reinvent your workplace even, to say, do we need all these cubicles? How do we, do we take and make half of it remote? How many folks can we fit in this room, trying to meet the 6 foot space? And if you can't, what are other strategies you can use to possibly meet that, like a barrier? The other things are, like you're seeing there, these administrative controls of, do you stagger shifts so every other day you're remote maybe? Or at any given time, there's only X% of the workforce is actually there, because some folks are 8 to 2 and then go home, and some people come in at 10. Just those sorts of strategies, so you're not potentially having 100% of your folks there at the same time.
Another thing that can help with, how, the liability question is challenging. I mean, it's a pandemic, so the risk is everywhere. So I think, as Dr. Nipp said, a good principle is, what reasonable steps are you taking to mitigate risk in your workplace? And I think another thing that is a helpful strategy, one of the things we really have found great value in, is having clear, up-to-date guidance, sharing that communicating it relentlessly down to our front line, engaging leaders and frontline coworkers in the solution so that they understand all of the things that are being done to promote a safe work environment. So do your coworkers know that staying home when you're sick and how to easily call in and report if you're ill is a safety intervention? It's elimination of risk. If you have put in an engineering control, if you put in administrative controls, you've implemented social distancing for team meetings and huddles, and you're calling that out, you've identified and made it very easy to do frequent hand hygiene, you've made cleaning products so people can frequently clean their personal workspaces, you've eliminated common high-touch items to the extent reasonable, and you point all these things out and you co-create these solutions with your frontline workforce, they're going to be engaged. They're going to say, hey, my employer cares about me. They care about our customers. They are trying to make a safe workplace. I think that really goes a long way.
How about visitor access? Should we restrict visitor access to our buildings? And if so, what recommendations would you make?
One of these things is it's really going to depend on your place of business. So if your place of business requires visitors to conduct business, obviously you can't eliminate that. However, you can control access. You can make sure that, for example, let's say you're a retail type business that has a lot of foot traffic. Well, can you limit the number of people in the store at any given time? Can you spread things out to provide social distancing? If you have clients that come in, instead of just kind of walk-in business, can you have appointments so those can be separated in time and you can assure people are not all crowding together in a lobby area? So it's really going to depend on your place of business. If you have a type of business where visitors are not an essential for your business function, you can reduce or eliminate visitors to your building to help reduce risk. That's one of the things that we had to do that was done, based on national and state guidance, is we have greatly limited visitation, for example, in our hospitals, because we have lots of sick people in our hospitals, including people with COVID-19. So we have had a greater duty to protect visitors from risks of infection. So we have a very strict visitation policy right now for our clinical areas.
What should I consider about my day-to-day functions and operations that could spread the virus?
All of the above, right? So hand hygiene, keeping sick people home, surface cleaning, thinking about eliminating common use items that would be high-touch areas. All of these are different examples, and it's really coming into your workspace with a different set of glasses on that say, what would be sources where this could, we could have spread a virus? So you think about the water cooler, the coffee machine, that stapler that everybody touches and uses 50 times a day, are 5 different people using the same telephone. Well, in that case, maybe everybody should have their own telephone so that you don't have 10 different people picking up a handset. Do we have people we can work from home? Because if they can work remotely or virtually, that eliminates the threat because it provides, there's no risk of exposure. So it's looking at that whole hierarchy of controls, thinking innovatively about how you do your work and say, what are all the things we can do together? It's a layered approach. One thing alone by itself is not going to be as effective as a whole set of interventions.
Okay, well, thank you very much for all of those answers and all the questions that people posed. I want to thank everybody for participating today. I want to thank our partners in this, Parkview Health, the Northeast Indiana Regional Partnership, the Allen County Department of Health. I want to remind you on screen is the Parkview Business Connect. If you have any question, please pose those to the experts and they'll get back to you within 24 hours with a great answer. So I want to thank you for joining us today. And if you have any questions, we are here to help you. We want to help you through this pandemic. We want to make sure that we can get business reopened in a safe and healthy fashion. And let us know if you have any questions. Thanks and have a good day.